This video is about a particular merit good, which is healthcare. So why is healthcare a merit good? Well, a merit good is a product or service that has significant positive externalities. So this means that the benefits of consuming the good or service extend beyond the individual consumer. So in other words, merit goods provide benefits to society as a whole and not just to the individual who consumes it, the first party. So healthcare is a merit good because it has these significant positive externalities. So when an individual receives healthcare, the benefits of their improved health extends beyond just themselves. They become more productive, there's less absenteeism, they contribute more to society. Additionally, healthy individuals are less likely to spread contagious diseases to others. And just in terms of healthcare itself, it's a fundamental human right, and it is absolutely essential for ensuring a fair and just society. So it's crucial for reducing health inequalities and promoting social cohesion. Now, in a free market, healthcare would be undervalued and underconsumed. So as it's a unique market, and what I mean by that is it's a unique market in that consumers or patients may not always have complete information about their healthcare needs or the quality of the services they're receiving. Now, this information asymmetry can make it challenging for consumers to make informed decisions about their healthcare, and sometimes they underestimate the need for it. They see the opportunity cost of having to trade off on other goods being too great. So the government realised the necessity of healthcare and intervene, and they offer free provision via the NHS. Now, regarding spending on the NHS by the government, is clearly going to be a substantial cost to the government, and it will put pressure on their budget. There has been an increase in healthcare spending, especially obviously during the pandemic, which needed COVID funds, but there are still concerns about the sustainability of the current funding model, particularly in light of the growing demand for healthcare services and the ongoing financial pressures facing the NHS. Now, it's worth noting that per capita, spending on healthcare in the UK is actually lower than many other developed countries. Now, if we consider the data, it shows that since the austerity years, the spending on UK healthcare has not kept up with the historical average of 4.1%. And as mentioned before, per capita is below the countries. So we see population here, it is expected to grow, which will put even more pressure. We have an ageing population. So with more people needing treatment, it's just causing waiting times to significantly increase. So we're starting to see people having to wait for longer than a year for treatment. So as we can see in the diagram, at P2, where the provision is free by the NHS, we have that demand at Q2. But current capacity of the NHS and healthcare is at Q1. So we see that excess demand. And that shows that at the moment it's allocatively inefficient. Now, the reason it's being criticised as being allocatively inefficient is that the government is not allocating resources to the areas where they are most needed. And that results in a mismatch between the demand for healthcare services and the supply of those services. So what we need is more investment in healthcare. And that can be capital, so for example, hospitals and machinery and equipment, but also human capital as well in terms of doctors and nurses, etc. But the promises haven't always been fully delivered. So as we can see, if demand is increasing at a greater rate than supply, all it's going to do is cause that excess demand to get greater. And if that excess demand becomes greater, then obviously it becomes more and more allocatively inefficient.